finish what you started, you came to the right place. Them girls that you came with, you might have to part with. Depending on how this thing shakes. Wauwatosa, Kenosha, is in the house.
Hello, Northeast Wisconsin, and a special thank you and welcome to Dr. Ashok Rai, the CEO and president of Prevea. Doctor, thank you so much for joining us.
Thanks for having me, Congressman.
So let's start with, who are you, Ashok, on a deep level? Tell us who you are, your background, and I think most people have probably seen you by now because you've done an enormous public service and going on TV almost every day to try and give people good information. And we want to dive into that here in this discussion. But tell us kind of your background and how you came to Prevea.
So I actually been with Prevea. It'll be 19 years this July. I came here right out of training. I did a double residency in internal medicine and pediatrics, and I came to start the inpatient hospitalist program at St. Mary's Hospital. So I joined Prevea back in 2001, and for the last 11 years, I've been its president and CEO. Still see patients occasionally, but most of my day job is on the administrative side, but I still enjoy patient care as well.
Fantastic. And for those who may be confused as to why there's a Lions helmet behind you and some other confusing football helmets, maybe explain that before we lose the tens of listeners we have on this thing.
Well, yeah, as you know, born in Ann Arbor, raised just north of Detroit. Still love my roots. Still, I cheer for the Packers too. There just happens to be 2 games a year that I'm slightly conflicted. Being a Lions fan, I have my collection of paper bags in the corner too.
Fair enough. Well, my wife went to Michigan, so we have some Go Blue spirit in the house from time to time that I try and keep under wraps because politically it's terrible. But okay, so you, as I mentioned, and first of all, I just want to say thank you as a Northeast Wisconsinite just for all the information you've put out there. You know, I've been able to see a little bit of all the energy you've been spending behind the scenes to make sure this community is as prepared as humanly possible. And I think we're lucky to live in a community that does have an extraordinary healthcare system where the providers all work pretty well together most of the time. And I think we have a chance to really bend the curve significantly. But maybe start with, you know, let's say I'm just a citizen in Northeast Wisconsin or a family, and I'm worried about, whether I have coronavirus or the symptoms. What would you recommend to that person?
I think, it starts with understanding the virus itself. So when we say we stopped using the word novel in the press, but really the term novel meaning new to a human. So this virus is new to humans, which means it's not like the flu. It's not like the cold. It's not like chickenpox. It's not like anything your body's ever seen. So everybody is starting from basically ground zero, no immunity to this virus. What we also know about it is it spreads really rapidly, which that means it's highly contagious. So if you're going to come in contact with it for a prolonged period of time, you're going to actually absorb that virus and it's going to infect your body. Now, everybody reacts differently to that infection. Some people are really lucky and they get no symptoms, and some people can get extremely sick. Now, I think unfortunately when we started talking about this virus as it came from Asia and then moved into Europe and now the United States, we kept talking about it, really killing the people who are over 50 or those who have diabetes and those who have asthma. And I think that gave us somewhat of a false sense of security. As we've seen in all of those countries, and especially as we've seen in America, this enemy knows no friend. I mean, it doesn't spare anybody. It happens to affect those with chronic diseases and older people more. But we've seen 20, 30-year-old people wind up on the ventilator. And unfortunately, what we're seeing in New York, they die as well.
So it'd be fair to say, and I think this was kind of a source of confusion early on, there were a lot of people that said, well, it only affects a very small percentage of the population. I'm fine. And so you're sort of pointing out 2 problems with that. One, it may affect you even if you're in the younger and healthier population. But also, you could be spreading it even if you have it and it isn't affecting you, correct?
Right. I mean, you are its tool. You are the virus's tool to spread. That's why we ask everybody, based on this infectious disease professor in the Netherlands, that said everybody needs to act like they had it, because you do. and you're spreading it every time. And that's why the only treatment we have is social distancing. As physicians, that's actually pretty frustrating. People come to us for a cure. People come to us to help you with your medical problems. You have a heart attack, they come to us to put a stent in you. You have strep throat, you come to us for a prescription. And really, the cure does not sit with healthcare. The cure sits with society. And that's what's so difficult. That's flipping, our normal paradigm on its head by saying the cure sits with everybody. And the only cure there is to prevent this virus from jumping from person to person to person, which means self-quarantine.
I think one of the things I've struggled with throughout this is, particularly in the age of social media, there is so much misinformation out there. There are wildly different projections about, whether you could extrapolate from data that we have from China, whether you believe the Imperial College study from the UK. There are Stanford doctors that are more on the, it's not quite that dire side. Is there, within the medical community, are people converging on projections that make sense? Or, where do you go to for information from this? And by extension, where should your average person in Northeast Wisconsin go to for good information before they forward, something they get from a bad source?
Go to the smartest infectious disease doctor in the world, Dr. Anthony Fauci. So, he's pretty clear about he doesn't have a crystal ball either. So I think my point in that is we're all looking at different projections. And the projections are really for us to plan the best we can. I keep getting asked, when will the surge hit Northeast Wisconsin? And my answer is, that's really up to you. I don't want a surge. I don't want to use that word in Northeast Wisconsin. And the only way to prevent that is for us to, be extreme in our self-quarantines or social distancing. Make sure you're truly essential if you're out and about. But, there are so many pieces of information out there. You're right. It's really confusing. And social media hasn't helped. Comparing this to influenza definitely doesn't help. We know that at the end of influenza, we're done and this many people died. This virus is nowhere near done killing in the United States. And I think, Dr. Fauci has pointed that out with some of the projections. It could be 100,000. It could be 200,000. If we did nothing, it could be, 1 million or more. So those are really scary death rates if you think about it. That means everybody in this country will likely know somebody who died from it. And I think that's really impactful. You think about all the impactful tragedies in the United States over our history. Very few times has everybody known somebody that's died from a tragedy like that outside of war. And that's why this is war.
It's interesting. I was thinking about the sort of the closest thing I could think of in terms of an event of this scale that affected the United States was 9/11, which happened when I was a senior in high school. But it's so different in the sense that 9/11 was this immediate destruction and loss of life. But the message the day after was, go back to work, don't be intimidated, go to the malls, et cetera, et cetera. Everyone's going to baseball games, feeling all patriotic. What's so pernicious about this is we're almost having to tell people the exact opposite. We need you to be disciplined enough to work with social distance, telework. We're not going to be going to Bucks games anytime soon. It's just a very difficult message to get across to Americans.
Yeah, this is war, and I think we need to treat it as such. The enemy is small. It's extremely deadly. It's invasive, and how you beat it is preventing it from jumping from person to person. And people need to understand that's what social distancing is about. That's what stay at home safe is about. That's what quarantine is about, is that you're trying to prevent the spread of the enemy.
That's well said. Okay, so let's say you've convinced that stubborn Wisconsin college student who was partying on spring break up until a week ago. You've convinced that equally stubborn, boomer, a population that includes some physicians in my own family, and the divergence of opinions on this issue within the Gallagher physician family is fascinating to watch. Okay, let's say I'm doing the right thing and I'm staying home, I'm trying to socially distance, and then I start to feel symptoms. What would be the symptoms associated with it again, and then what should I do after that?
So actually one of the earliest symptoms, and this was reported in Asia, and I think I kind of flipped past that article, then Europe talked about it, then we started to see it in New York, and then I actually got a chance to talk to some patients, and it's the loss of taste and smell actually precedes a lot of the overt symptoms, such as fever, sore throat, shortness of breath. So, and we've actually added loss of taste and smell to our triage questions. And triage questions are questions we ask you either online or on the phone to try to put you in a category to treat you. That's what a triage question is. Answer yes, go down this path. Answer no, go down this path. And we've actually been pretty convinced that taste and smell has a large component to this, which adds a whole different complexity to the virus that we weren't aware of. But really, taste and smell, fever is pretty common. Sore throat, shortness of breath. Some people get stomach symptoms as well.
So, okay, so loss of taste and smell, fever, would chill, did you say chills could be associated with it as well?
Some people get chilled just thanks to the fever and how they regulate their temperature, but fevers, and we're talking, some pretty good sized fevers out there that we've seen reported. Wow. 102.5, you're sweating, you have a temp.
Okay, so let's say I come down with one or more of those symptoms. What should I do? Do I immediately rush to go get tested, or what is the protocol?
No, because I think the most important thing to remember is the treatment does not lie with healthcare. The treatment lies with you being at home, especially if you have symptoms. So there are certain people that need to be tested, those that have significant risk factors, because if we know they have COVID-19, then we'll probably have a different kind of watchful eye on them. Those that are in healthcare, because we don't want to be spreading it. Those that are in law enforcement and say the prison environment, from the law enforcement that works inside the prisons to make sure, they're not spreading it. Those who work inside nursing homes. And those that are on the ventilator are very sick in the hospital. Those are your highest tiers in the state of Wisconsin. And then you have a tier 3, which is, once again, people who are sick, don't have the whole constellation of symptoms, not bad enough to be in the hospital, but have risk factors. They also get tested. And then you have tier 4, that's some of the public surveillance that public health asks for, pretty rare there. And then you have the do not test. And the do not test is the Congressman Gallagher who has a fever, who has a sore throat. You would call us, you would go on our virtual care, and we would give you, this is what you do for your fever, this is what you should be watching for, and please don't come in. So don't come to the emergency department. That's for emergencies. So if you cannot breathe and you're so short of breath, then you'll come to the emergency department. There's a number to call to get inside the garage door, and we'll actually bring you in securely through there. If we do bring you to a testing site at Prevea, we won't get you out of your car. We'll actually have you drive up. We'll put on our personal protective equipment. There's signs. Think you are out at one of them. And we'll come out of the car, and we'll come out of the building and test you. You stay in the car. That's to keep you safe and us safe and keep the whole community safe.
So just to follow up, if I am symptomatic and confused about what tier that I fall into, and I appreciate the not so subtle message that members of Congress are on a tier slightly south of cockroaches in this hierarchy that's probably appropriate. Would it be fair to say the best thing to do would be just to call your physician, or what if you don't have, a regular physician? What would be the best way to figure out what tier you're in?
Bell and Aurora, Prevea, we don't care who you go to at this point. Actually, all of us meet on every morning virtually to discuss what's going on in town. And I'm very proud of my colleagues at Bell and Aurora and HSHS, St. Mary's and St. Vincent's here in town. We've put all that aside. All 3 organizations have kind of a hotline to call. You can go to the website. All 3 organizations have a virtual care platform. Ours just happens to be prevea.com/virtual care. Bellin has one, Aurora has one. Use those tools. We want to talk to you. It's not that we don't want to talk to you. We want to make sure that you're doing okay. We're going to have some pretty strong questions to make sure if we need to see you or not. So don't ignore it, but just don't come in.
Don't immediately isolate, but don't immediately rush into the emergency room. Talk to the healthcare providers and then determine. But presumably someone could reach a point where, if they're really feeling bad, then they could,
Bellin's done a great job here in town. They have an upper respiratory clinic. So if you answer yes to a certain amount of questions that they actually need to see you, they've now gotten one specific site. Prevea will launch theirs on Thursday. One specific site for those symptoms. Keep you out of the emergency department. make sure we can examine you, but not expose everybody.
So let's talk about testing more broadly. It does, for the layman looking at this, it does seem to see that the countries that have more successfully weathered this, testing was a key ingredient, because testing provides data. And as you know, to extend your analogy, if this is a war, you wouldn't go fight a battle without intelligence about what the battlefield and the enemy looks like. And so we are trying to ramp up our testing, not just in Northeast Wisconsin, but nationally. Maybe talk to us a little bit about how that's going, and where do we need to go in order to get to the South Korea model and avoid the Italy model?
Yeah, unfortunately, it's probably been the great American failure when we look back in the rearview mirror, is not having mass testing capability. South Korea really did a good job. China's done a very good job with this. Italy maybe wishes they would have tested sooner. Other parts of the country, other parts of the world have done a really good job. People keep thinking that, the United States is doing a better job because look how many people we tested, look how many positives. If you actually looked at the number of people we're testing based on our population versus Asia, we're actually doing a really bad job of that. There's a lot of factors in there: the availability of testing, the availability of the equipment to do the test, such as the nasal swab that we put into your nose, the liquid it goes into to preserve it, to kill the virus, but preserve it for testing. We are constantly battling that. Northeast Wisconsin was supposed to get its first delivery of tests today or this week through a couple companies. And we are informed on the phone today that the DOD has taken over and sent those to other states. And we understand that New York needs that and other states need that. But if we're going to win this war in Wisconsin, we need to test. We need to test 2 weeks ago, 3 weeks ago. We need it right now. So we're getting very entrepreneurial on this. We're working with our local business leaders. We're finding companies that can produce this for us. We're asking some of our people here who have personal aircraft, go help me get it. We're making all of those types of asks right now. We're being extremely aggressive. I really can't rely on anybody but us right now and our own ingenuity here to get testing to Northeast Wisconsin.
So let's say I'm a manufacturer that happens to have extra masks on hand because I work in the painting industry and we wear masks in the roofing industry, and I want to help out. Is there a mechanism right now for how they could donate directly to your hospital?
Actually, I think the governor set up a pretty good situation for those donations and collection points as the county, and we want to make sure that stuff gets shared equally. So there are different online resources, both from the state and the county, where we can get those donations dropped off and then redistributed safely. I mean, as a hospital system, we need it, but so does EMS, so does the ambulance drivers, firefighters, policemen. We want to make sure they're getting their PPE as well. And so everybody knows PPE, we use that term a lot, means personal protective equipment for coronavirus. That's eye goggles, face mask, then a mask, our gowns, and our gloves.
That's critical. And just a quick plug, my office has a partnership with the county where we're going to be accepting donations, and I'll have more on that. But if anyone has such supplies, you can reach out to my office, gallagher.house.gov. Quickly on testing, you said something that I think is really important and is going to be something we have to do when the dust settles, when we get out of this, is take a hard look at ourselves. I know there's been a lot of people, myself included, that have focused on the Chinese Communist Party's malfeasance, which I think is very real at the origin of this crisis, but that does not excuse some of the response failures we've already seen. And it's been fascinating to me how many single points of failure there are in our supply chain when it comes to testing or pharmaceuticals and treatments. And I'd just be curious to get your view on that, and whether you see sort of, 5 years from now, if we learn the lessons from this, whether it will result in more of this stuff being made domestically, more stuff being put in the stockpile. Maybe too early to draw these conclusions, but if you can offer tentative hypotheses, I'd be interested.
Yeah, when this is all over, I'd be happy to come on down to Washington and tell you all what I think of you in this process. But, I think we'll look at it in hindsight. There are a lot of things we could do differently, even within healthcare. We knew what was happening. We were preparing. We became over-reliant on others to help us. And I think, healthcare needs to step up and lead. We're somewhat disjointed in healthcare leadership around the country. And I think we could have done a much better job speaking with a single voice instead of, the hospital speaking over here, the doctor speaking over here, and the pharmacist speaking over here. The surgeons put out something here, and the gastroenterologist put something out here. That didn't help anything. We should have come together, single voice of reason, single voice of demand, and really been able to flex to the critical points to cut it off quickly. We should have been a little bit more forceful with our local governments and our state governments around quarantining, because we're scientists. We learn from observation. Every scientific study is an observation. We were observing what was going on in Asia. We were observing what was going on in Italy. And we've learned a lot in that time period. We have to learn faster, and we have to cooperate faster. And I think there's a lot of things that we've learned. But as a country, we have significant supply chain issues. Catastrophic failures there. We're the most technologically advanced country in the world, but our approach to testing has been about as close to third world as we can get. And those are situations that we're going to need to resolve. We're going to need to relook at our regulatory bodies and the permissions that they're given during crises. We shouldn't have to wait for orders and laws. There should be an automatic, trigger for a lot of this. And regulatory bodies need to go from regulating to assisting in situations like that, and actually going out there and finding the manufacturer, encouraging the production, instead of saying, well, call me when you get it done.
Very well said. Quickly, on the topic of PPE, I know masks are in high demand. And am I right to understand the distinction between there's sort of the general surgical mask and then there's the more advanced N95 masks? And
Right.
Talk a little bit about the needs for both.
So N95 masks are really required for when the virus is aerosolized. And, it's been debated, is this a droplet virus or an aerosolized virus? Given the size of the virus, to be completely careful in certain procedures we do in healthcare, we need an N95. In other words, when we're putting a tube down your throat or any kind of what we call aerosolized procedure, we definitely need to have that N95 on. Everywhere else, the CDC says, and we have to go with the CDC guidelines, we all have our own opinion, but the CDC says droplet precautions are fine, which would be a simple surgical mask. The most protective, though, obviously, would be an N95, especially when you're dealing with in an environment with patients everywhere around you, such as what we're seeing in New York. The thing about a surgical mask is it's meant to be disposed right away. An N95 can be disposed right away, and there has been some research on sanitizing them as well, and we're looking into those procedures going forward. But we're not talking long-term sanitization. We're talking like use it 3 to 4 days in a row, and then get rid of it unless it gets soiled. So it's hard to understand, because there's also N95s for manufacturing in different environments, but the healthcare ones need to be fitted. You need to be tested for it to actually work, and we need to be careful about that. And once again, we've seen supply chain failures there. Everybody's running out of the aerosolized bitters to actually taste during your fitting. So we can't fit people because we're running out of equipment there too. And there's other personal protective equipment, such as what we call cappers and pappers. That's when you see the people with the big masks and the hose coming out. That's the ultimate in protection in an aerosolized type of situation.
For the lower tech, just general masks, I think there's been a bit of confusion about the initial guidance that came out said, if you're an average citizen traveling or walking around, don't wear them because it doesn't help. I seem to think there might be a course change on that in the last 24 hours. Can help me understand that?
Well, more than anything, now that we have community spread, so that means that you have a virus in the town and nobody can track it back to travel. Putting masks on people, initially, people are putting masks to protect themselves. The people who needed the masks are the people who have the virus that are not spreading it. The reason why we're seeing more global masking is because we now have to act like everybody has the disease.
Interesting. Okay, so to get more broadly, we've covered testing, we've covered PPE, treatments. I know there's been a lot of debate about the efficacy of certain things like hydroxychloroquine and other drugs that are out there right now. I think there is a lot of hope that with the regulatory freedom the FDA has given various pharmaceutical companies, that we will see treatments come quicker to providers and to the market. I just give us sort of where things stand in terms of potential treatments from your perspective. And I'm not asking you to weigh in on whether hydroxychloroquine works. I mean, I understand what Fauci's saying. We need randomized trials, things like that. But just be curious if there's anything out there you think is promising.
I think actually the early studies on plaquenil and azithromycin, hydroxychloroquine.
That's all the same thing, right? Plaquenil is hydroxychloroquine. Okay, got it.
And azithromycin, the other drug that they've been giving with it, better known as the CPAC in America. It showed some promise, but it's very hard to tell. I mean, there's so much noise around this because it's happening so fast. And we're taking very small samples of patients with very different genetic makeups than, say, an American person, where we are a lot less homogeneous here or we all look different here versus some countries where we all look the same. So the studies are really skewed. The data is not great. And we don't want to make life and death decisions with these medications, and we don't want to make anybody worse. And just because a medication's been on the market for 50 years doesn't mean it doesn't have significant side effects or that it can't kill you. It just means that it's been doing its job, balancing that out for over 50 years. So I think, the one thing I caution everybody is don't go run to the store or try to get this medication. Don't go to the aquarium shop and buy this. We've seen some death because of that. We have to be very careful. There's also other medications being looked at, some of the HIV drugs, some of the other antiviral drugs, but we need time, and we need a lot of time. And the only thing that's going to give us time right now is the one cure we do know about, and that's social distancing.
That's well put. And vaccines presumably would even be further away than a treatment, though, I've heard at times various promising developments. You'd think with sort of advances in synthetic biology, vaccines could come to market sooner, but they still, even in this world we're living in where we've loosened all the regulations, FDA still has to go through a process to get to a workable vaccine.
Yeah, I mean, it's two things with a vaccine. You want to make sure it doesn't cause harm, and you want to make sure it works. We don't want a false sense of security and then have another crisis. I think the earliest you'll probably see any vaccine to the market would be early 2021, and that'd be really early.
Wow. So that's, not till 2021, I think. Yeah, because I honestly, what I get, almost every day, someone's emailing me saying, well, just give everyone hydroxychloroquine and then we can go about our business. This is it. It works. And you're saying something different.
No, it doesn't. And it doesn't globally work like that. And it can be extremely dangerous. That's why social media should stick to, cat and tiger memes. And off of healthcare topics, because there's a lot of scary things that are being put out there. And no, that could be catastrophic, giving everybody a medication like that.
So quickly, I know you to be a very tech savvy person. The meaner way I could put that is I would describe you as a tech nerd. You are very tech friendly. Is that accurate?
Let's just put it, I'm more of a geek, all right? Let's just put it out there.
Okay, we'll go with geek.
I like that term. I am totally fine with that term.
Talk about, the intersection of traditional healthcare and some, data analysis we have right now. To me, it's astounding, given what I've seen in the intelligence community in my past life, that we aren't able to provide in near real time some sense of where are the supply chain vulnerabilities, mapping out community spread via contact tracing, just basic numbers of how many people tested negative, how many people tested positive. Are you seeing the technology catch up to the healthcare community and the two sort of communities work together? I don't know if that makes sense at all.
And I am. And I think Johns Hopkins has actually, really been out in front on this one by getting all the Department of Health Service stuff put into a usable spreadsheet that everybody can then slice and dice every day after, I think it's 2:00 Central, all the data is updated. So we're starting to see, trends and be able to react to that. The biggest issue in all of this is the data isn't great. So nobody wants, I think even Dr. Fauci said, these projections are based on the data that I have, but that's a pretty limited number of people being tested. And I don't think you'll ever really get good data. You'll ever get good analysis without good data. Once again, you wouldn't go into battle without knowing what you were going into. We're going city to city trying to figure out how to fight this blind. No radar. And to us, that a radar would be testing. So we know hotspots. We know areas to quarantine a little bit more aggressively. We know where we could take patients to because they have 5 open ICU beds. They don't. This is where the most amount of PPE is. Maybe we should redistribute. Those are all things that easily could have been worked on if we had the data about where the disease was going, if we had that real-time spread data, which would only come from testing. And that could be totally done, that you can totally do that HIPAA compliant. You don't have to say, Joe Smith has it, Mary Smith doesn't. We could have done that and maintained HIPAA. I know that's been thrown out there a couple times. Privacy had nothing to do with this. Privacy could have been totally maintained. It's just a sheer lack of testing ability.
So what about some of the more advanced tests that have been announced or coming out? Abbott, for example, says it has a point of care test that can produce a negative in 13 minutes, a positive in 5 minutes. Do you think that has promise? Could that help us get that data we need to fight smarter?
So it has a ton of promise, but then you need the toaster oven size device that not everybody has. Bellin doesn't have them, Prevea doesn't have them, Aurora should see if they can find them within their system. And then you need to be able to acquire the cartridges. All of that stuff's been diverted to New York. So the DOD has taken control of that supply chain and diverted it. And those tests still require you to have that nasal swab and that and the ability to put the swab into something. And those are also in short supply. So that was great news on Friday that there's another test, but it was like 1 step forward, 2 steps backward once again, because it's a point of care test without all the equipment to do it.
So it's interesting. This is kind of a right turn here. As we await, technology and, the federal government, the state government to save us, it does seem like I've seen positive signs of individual resilience, at least in my neighborhood. I have seen more people in the park in my neighborhood than I've ever seen before, more people on the weekly running trail I do at the UWGB Arboretum, just to make sure I'm not putting bad gouge out there. It's still good, if not encouraged, for people to get outside, stay healthy, do it within the context of social distancing. Don't have a party at a park and high five everybody, but still a good thing for people to be enjoying the natural beauty of Wisconsin.
Yes, it's sunny outside. I know you're in the basement. I can look out the window. I did see the sunshine for a couple minutes. We should be out there. We should be getting fresh air. We should be taking walks. Just maintain that social distancing. And that doesn't mean interacting with other families. You have your family. That's the people you're allowed to be exposed to, nobody else. Unless you have a mission critical job, that's your circle, that's your quarantine. Don't mess with somebody else's quarantine, but definitely maintain that distance and be out there, honk and wave when you can. And, as somebody who's tried to get Green Bay out and moving his entire career and trying to make us a healthier town, who would have known me telling you to sit on your couch would actually get people out moving suddenly? It's been a little ironic lately, but we do want people to take advantage of the opportunity to be well, because the healthier you are, the better chance you have of surviving this. And remember, you don't have to be 50 or older. You don't have to have diabetes. It's killing young people too. So get yourself in good shape right now.
That includes presumably mental health, which presumably is correlated itself in terms of stress with decline in physical health.
Yeah, and we're really worried about everybody's mental health. And I understand the boredom association associated with this, the social isolation for people who need that, people who are depressed. That's why, things like what we're doing today, using, telecommunications is great. Check in on your friends. I try to do a couple wellness texts every hour when I have a break between what I'm doing. Just, random people that I haven't talked to in a week, friends, family, and just quick wellness checks to making sure they're okay, telling them to stay well, telling them you love them. Those are really important things to be doing every time you get a little bit of downtime. Every commercial break, when you're stuck watching TV, it's a good time to go check on somebody. And I think as a society, this is our time to prove why we are the greatest country in the world. And it's because how we act and how we respond to crises around the world. We'll help everybody else, but we got to help each other too.
So to steal a phrase, there are still ways to get after it mentally and physically, even within the context of this crisis and with social distancing in place.
Most definitely. I'll let number 12 know you quoted him there.
Tell him if he wants to come on this Zoom with literally tens of followers. And I apologize that I have number 15 back there, not number 12. But okay, so quickly on testing, let's say we got to this point where we could ramp up testing exponentially. We got a better picture of the battlefield. We understood kind of how this thing is moving and evolving. Do you think there could come a point where we could transition to a hybrid model of, whether it's the Denmark or the Sweden model of, we continue to isolate people who are vulnerable or already infected while we allow gradually, assuming it's safe, other people to go back to work, still doing social distancing?
Honestly, we could do that in 30 days if we did it well. It's not like it took Denmark or South Korea months to figure that out. It took them weeks to figure that out. Once we can get mass testing, we can reorganize ourselves because, like some of those mass tests, like the one where you do a little prick your finger and get a drop of the blood, you're looking for antibodies actually. So if I know you've been exposed and you're done with it and you're essentially immune, that's what we think, that you can't get it again, you're back on the front line. You're good. Get out there. Socially distanced, but get out there. You have active disease. You hang tight. I don't want you anywhere. And you've never been exposed and you have risk factors, I really want you to hang tight till we can clear this out of our society. So I think it can be done really, really well if we had that ability for mass testing. You need a couple different tests out there for different scenarios. We still need the nasal swab rapid test. We need the blood test. We need both of those combined to get us a really clear picture. And with that clear picture, if we had all that data, we could get back to work months earlier than I think is projected.
Well, that's hopeful news. And I think that would go a long way towards, if we could get there, giving people a light at the end of the tunnel, right? I think Wisconsinites are willing to sacrifice and help their neighbors, but they want to sort of at least get a sketch of what the end game looks like. I think I'd be curious to see, particularly for the countries that took the, let's just call it the China model, for lack of a better term, where it was almost a quick lockdown as opposed to the hybrid model. And my understanding is that the UK started over here and then tried to transition. Are the ones that took the more draconian, aggressive approach at risk, you think, of a so-called second wave of infection later on? Or do we just not know enough about this virus to be able to predict a second wave?
It's hard to know if we're going to get a second wave or not. It's hard to know about reinfection, about its mutation. So right now we got to go with what we do know about. I think the people who lock down are going to see a secondary surge, not because of what's happening in their own society, is if they ease up on travel. And they're bringing people in that weren't locked down with active disease. So in other words, you're reintroducing it into your environment after you've shoved it out. I think that's what we saw in Hong Kong. And I think that's some of the concerns that they have in China as well.
So this is, as we look forward to that day when we are out of this and, we look back and we're trying to learn the right lessons. And we've talked a little bit about some of the failures in the system on testing in particular, dependency on foreign goods and manufacturing for drugs and basic medical equipment. What do you see some positives coming out of this beyond our ability to fix those? I mean, I was struck by, I would just offer an enhanced role for telemedicine possibly being positive. When I visited the drive-through testing facility at Prevea, I thought, could we not have drive-through facilities all the time? Stuff like that. Do you think this is going to force us painfully to evolve, and will it make the healthcare system look a little bit different going forward in a positive way?
Most definitely. I think we'll see the evolution of telemedicine even more. I think it'll actually educate America that hospitals aren't the beacon of hope. That's where the war is fought, and that shouldn't be the center of healthcare decision making. That should be outside of the hospital. We need better strategies to prevent people from going to a hospital. And that, you're going to start to see some of that change in mindset. And hopefully people listen to providers a little bit more. I've been really, really blessed to have chosen to come here almost 19 years ago. I look at how different towns use their media and how the media deals with them, and to be given a platform to educate almost every day, Monday, Wednesday, and Friday, and then every day on the radio, to be able to given a platform for education and not trying to, create negativity, but actually caring about the community. We're really lucky on where we live in Northeast Wisconsin, and I think hopefully people can learn from us on what we've been able to do from a positive standpoint rather than getting so stuck in the negativity that we're not being creative. Those testing sites, they were brainstormed in a day and up in 2 days. That's the Green Bay way, and I'm really proud to live here.
That's awesome. And as I've heard you say on multiple occasions, this place is unique because we take care of each other. That's in the bloodstream, that's in the water in Northeast Wisconsin. And I think what you said, I'm not sure everyone would appreciate just how radical of a shift that would be in the healthcare community. This idea, this paradigm shift of going, and I don't want to put words in your mouth, but potentially going from a fee-for-service model to how do you keep people healthy and outside of the hospital and do population-centric healthcare. I agree with you, if I'm capturing that correctly, that is a direction we need to head, but you would admit that is a massive paradigm shift, correctly?
Massive paradigm shift. Value-based healthcare is where we need to be. I can't believe it took a pandemic to get us there. It's what I testified to Congress on a couple of years ago. It's what I'll continue to make a private mantra on this, that we cannot continue to be focused on sickness. We need to focus on keeping everybody healthy and reward providers, not for doing things to people, but for helping them be the best person they can be. And that's a big paradigm shift in healthcare. It's worked in other places. We obviously are seeing significant failures in our healthcare system right now, and there'll be plenty of time for finger pointing, in the months to years to come. But if we don't learn from this, if we don't evolve from this, then we've let people die in vain.
Okay, so looking ahead, well, first of all, you're wearing a blue ribbon on your blazer there. Maybe explain why you're wearing a blue ribbon, why I have a blue ribbon tied to the tree outside my house in Alloway. What is that all about?
So, when I started doing some of the media broadcasts, everybody's sent me some really nice messages. I also got some interesting messages on social media, and someday I'll go back and read them, but my wife has told me about them. But really a lot of thank yous, and to the point that it was almost uncomfortable because I am just talking on the behalf of my partners all throughout, trying to educate people. The real thanks goes to my partners who are in the emergency department, that are in the family practice centers, in those that are practicing pediatrics, the intensive care doctors, the nurses, the respiratory therapists, our plan ops and our janitorial crews, the housekeeping crews that are cleaning up a room after somebody with COVID's been in there. That's frontline stuff. And, when we've gone off to war in the past, tying a ribbon around the tree symbolized that you'd be welcome home. Whether you were a POW, whether you were captured during the Iran crisis, or in other times of war, the ribbon was signified that you're welcome home. And a lot of healthcare right now, they need that thank you. They need to be welcomed home. So we started a movement and this is the color of our scrubs, the light blue ribbon. We tried to simulate our scrubs the best we can, and that's our Army, the Blue Army. And I just wanted everybody in Green Bay, in Brown County, Northeast Wisconsin, to tie that ribbon so my family, the Prevea family, the Bellin family, the Aurora family, would know that we're all welcome home. And it's caught on kind of throughout the state and a little bit nationally now too. Today's National Doctors Day, and we want everybody to recognize, not just doctors, and feel very lucky to be part of this unique profession and the largest army in the world when you think about it.
That is awesome. And so those of you who are going to see this, get out there, support a blue ribbon, support the Blue Army. I think never before have we been given an appreciation for what those on the front line, our healthcare professionals, doctors, nurses, hospital administrators, but also cops, firefighters, etc., how we depend on them in 1,000 invisible ways every single day. So just a small way you can show your appreciation. So in the few minutes we have left here, I want you to answer some questions about healthcare that I have been harboring for my entire life as a member, the only non-physician in a family of physicians. So first of all, scrubs, to this, and this is what made me think about it, the blue ribbon. I thought the whole point of scrubs was that they were supposed to stay in the hospital so as to not infect the hospital. And yet every doctor I know, including my father, my sister, all my uncles. My aunt, who works at Prevea, loves wearing scrubs everywhere. I'll see him at the gym wearing scrubs. Where did scrubs go wrong, Dr. Rai?
They are supposed to stay in the hospital, but, not every OBGYN knows what they're doing. That's a message for you, Dad. And we really try to keep, especially the light blue surgical scrubs, in the hospital. Put them on when you get there. Take them off when you leave. Keep your family safe. Now, when we wear our own type of scrubs, you see all these different colors and fun smocks. That's really, when we're out in the clinics, there's a different kind of scrub for that. But our traditional blue surgical scrubs are really meant to stay in the hospital. So, and then we start to, socially stigmatize those who may walk off with them.
It's hard to stigmatize people that have no shame. I won't sort of tell you who I'm talking about, but
well, I tried to call them out right there.
So second to last question. I know you've been working nonstop. Have you had any ability to unplug at the end of the day? And if so, as we all sort of are kept up in our houses, either reading books we haven't read or watching shows we haven't read, what is your guilty pleasure during this crisis?
So I started the Tiger King yesterday and I finished it yesterday. So I will be I'm going to go ahead and admit to that. I think my wife stated today on social media, you need to stay home like you're trying to avoid Carol. So I learned a lot about a part of the world that I never knew about, called Oklahoma. And so that was educational in its own way. Really just tried to relax a little bit yesterday. It was my first weekend that I did not go into the office for the entire day. The preparation for what's coming is extremely intense, to right-size the organization to be ready, and then to make sure we have our plans from a surge standpoint, from testing, and then reading constantly to make sure that we're up on what's the latest. There'll come a time when the hospitals are really busy and I'll trade in my sports coat for my scrubs and we'll leave this office to go to the hospital and want to be ready for that as well. But at the same time, it's all about the Tiger King, I guess. That's probably the most successful launch of a Netflix series to pick the time to do it during a pandemic. It's
got to be. Someone was joking on Twitter that the only thing that unites America right now is the Tiger King. Everyone has watched it. Okay, the most important question, if you assume we're going to get through this and Northeast Wisconsin will set the standard for the nation, will we be celebrating your successful fight against the virus at Lambeau come September?
I really hope so. I think if we do this right, we get back to some normalcy, late spring, early summer. But we got to do it right. The power to win, the power to get back to normal doesn't sit with me as a physician or with any of my partners. It sits with all of you. It sits with Northeast Wisconsin. And it sits with the ability to do testing. Those two things combined, if we did this right, everybody keeps asking me when the surge is going to come here. And my response is, well, that's up to you, because I'd rather not see one.
That's very well said and a great note to end on. And Doctor, I want to thank you. I've gotten to see the many ways in which both Prevea and you and yourself personally contribute to the community here in Northeast Wisconsin. I'd say the same about our other providers. We're lucky to have, as you mentioned, hospital systems working together. It really does make me proud to be a Northeast Wisconsinite. And so I just want to thank you for taking the time to inform people out there and for your personal dedication to winning this fight. So thank you very much.
Thank you, Congressman.